Hi everyone, welcome to the webinar this afternoon. We're just waiting for everybody to join. We'll make a start in a couple of minutes. Welcome everyone. We're just waiting for everybody to join the session. So we're just going to start in a couple of minutes time. If you'd like to use the chat function to introduce yourselves to each other, that'd be a great thing if you could do that. Hi everyone, welcome if you're just joining us. I'm just going to give it a couple of minutes to let everybody join, and we'll start probably in about a minute's time. But if you want to, you can use the chat function to introduce yourselves. There's also a Q&A function, which I'll explain in a moment, to use if you've got any questions you want to ask as we work our way through the slides this afternoon. Right, okay. It looks like the numbers have slowed down that are joining now, so I think we'll make a start. So welcome everybody. I can see some of you using the chat to introduce yourselves. Thanks for doing that. It's really nice to see who's joining the session today. I'm Sally Wilcox. I work for the Better Security, Better Care programme on behalf of IPC, which is part of Oxford Brookes. And I'll just be taking a maximum of an hour this afternoon to take you through some slides. And there's also a couple of opportunities to ask questions. So this webinar this afternoon, just a bit of housekeeping before we get started properly, is for care providers who are almost ready to publish your DSPT, but there may be something that's preventing you from publishing it. So we focus on some of the sort of more tricky aspects of the DSPT that you might be finding difficult, but as I said, you can ask questions as well. There's a Q&A function that we ask you to use today. So I've got Marta with me and she's going to be monitoring the Q&A. So if you've got questions, it just makes it easier for us to monitor them if you use that rather than posting them in the chat, because they tend to get lost in amongst all the other kind of chat that might be happening there. It's easier for us to kind of pick out your questions. If there's anything that's something quite simple for her to answer, she'll do that within the Q&A function. So she may well post you a response or some links or something. But if not, then you can ask it when we pause for questions. She can highlight anything if there's any themes coming up or anything that she's not been able to answer. If you're joining us from a phone today, you can also use the Q&A to find it. You can see the screen controls and then choose more on your screen, and then it will bring up the Q&A option for you. If there's any questions we can't answer this afternoon, hopefully we can, but if there is anything that you've not been able to go away with a satisfactory answer to this afternoon, we will get back to you. So no more than an hour, as I said, and at the end, we will send you the presentation, the recording, and from the presentation, you'll be able to access all the links that you can see in it. So try to make it as useful as possible for you so that you can just click on links and it'll take you to the resources that I'm going to talk to you about this afternoon. So just before we get started, it's really useful if you can fill in a poll for us. So it's just going to ask you what level your organisation's currently at on the DSPT. If you've personally used the DSPT before, and if you're a single or multi-site, it just helps me to tailor a little bit how much emphasis I put on the different parts of the webinar this afternoon. So if you could all do that now, please, that would be really useful. Okay, so what we've got, so we've got, looks like the majority are at standards met. We've got some that are approaching standards, small number that think maybe you're at entry level, maybe one that's at standards exceeded, and a few of you don't know. That's fine. Have you personally used the DSPT before? The majority have said no, actually. So 67% of you have said no, you haven't used it before. And the majority of you single site organisations with a small number that are multi-sites. Okay, that's useful. Thank you for doing that. Okay, moving on then. So our agenda for today, so we're going to be looking at completing and reviewing your DSPT, which are the questions that might be holding you back. So we know that there are some that we get feedback that care organisations find more difficult than others. So I'm going to be concentrating on those. Publishing or republishing your DSPT. Then we have got time for questions built in at several points, but if we get time, we've also got some extra tips. I'll explain to you the support that's available through your local support organisations. And then at the end, we've got a bit of time for questions as well and next steps. So, so you need to complete your DSPT at least annually, at least once a year. They're all together on the DSPT, there's 78 questions, but for social care organisations, there are 42 that you need to answer to reach standards met. But you also get the option that you can complete just a subset of 26 of those, which are mandatory if it's your first time, your organisation's first time completing the DSPT. So I'll explain that in a little bit more detail. So your 22-23 DSPT will be out of date as of the 30th of June. So you will not then be able to rely on it for anything that you're using for contracts, commissioning, CQC inspections and that type of thing. So that's why we're doing these webinars now, is because we need to get you across the finish line, ideally for the 30th of June, so that you remain compliant the whole time. But the next one for next year isn't live yet. So what is it that you need to do to go in and to complete your DSPT? So because this webinar is aimed at kind of getting you across the finish line, I'm not going to go into a lot of detail about how you register and how you get started. If you need that type of support, you can either look at our resources on the Digital Care Hub, or you can go to your local support organisation and they'll explain all of that to you. We've got videos that explain all of that in detail to you. So this is assuming that your organisation is already registered or that you've had help to register. So you need to go into your organisation's profile, and the really key thing around that, getting the right set of 42 questions that I mentioned just now, is that when you set up your organisation profile, you click this button here that highlights that you choose social care. So we've done a lot of work with the sector, so that's when you click on that, it gives you the right questions in the best order for you to make it easier for you to go through and answer all the DSPT questions. I've added a couple of useful links in here as well. So there is a link there in how to register, how to log in and make changes to your registration. So maybe if the DSPT is new to you, your organisation might be registered, but you might never have done it before. So there's some useful explanation there on how you can go in and get access, and also a link there to find your local support organisations. If you're with an organisation that has got more than one site, so that is, you don't just have one care home or just one office for a domiciliary care provision, you'll be using a headquarters code. to do your DSPT. And you'll see on your screen that you can review your branches and choose which ones you're completing your DSPT for when you redo your publication. So for a multi-site organisation, you can use one assessment for all of your sites that you can equally answer all the questions the same. So if you use all the same policies and procedures, you've got all the same staff training arrangements and things like that for all of your different sites, then you could do a single assessment for all of your sites. If, however, you can't say that, you don't have all the same policies and procedures, maybe you've got, say, like half that you could and half that do something different, or you mostly do it all, but you maybe acquired a new site or something like that, then you can choose which ones you're going to apply to your headquarter code. And then for any that are different, you can go in and do a separate assessment for them. So if this is the first time you've published, so the first time your organisation has published its DSPT, you've got two options. So there's a mandatory set of 26 questions that you would need to answer to reach approaching standards. And these are highlighted within the DSPT. They'll say next to them when you go into that social care assessment that they're mandatory. Or you can answer all 42 questions within that view, and that will get you straight to standards met straight away. If you chose the first option to go for approaching standards, you can only do that once. So then when you came to review your DSPT, presumably that would be the following year, then you would need to answer the remaining questions that you haven't answered. If you're republishing, all of your previous answers will still be there when you log in. Get access to your organization's DSPT assessment. So you can just go through them, review them, make any updates that you need to. If you've made any changes, say, for example, you had a new privacy notice, you can change the answer, put the right privacy notice on it, or whatever changes you need to make. But you do need to answer all 42 mandatory questions to be able to republish. So if you published at approaching standards in the first year, you would have an additional up to 16 questions. So however many you didn't answer in the first year that you would need to answer, you cannot republish at approaching standards. So if you're going back into republish, you need to answer all of the mandatory questions, which is 42 questions. There are another 32 questions in the view that you will see on your after your first publication. So when you go back in after your first or subsequent publications, you're in a screen which has got all 78 questions. You don't need to answer all 78. You just need to answer the 42 mandatory questions. Okay, it's a little bit confusing because when you first go into publish, you only get given the 42 questions, and the 26 mandatory ones are the ones for approaching standard. After you publish the first time, you go back in, it gives you all of the questions, and the ones that are highlighted as mandatory are the 42 that you need to answer all of them. Hope that makes sense. So what's new? If you're republishing, you'll be aware that there's this question 3.2.1 about at least 95% of staff have completed training on data security and protection and cybersecurity within the last 12 months. And this was a question that we knew care providers found quite tricky to answer because the National Data Guardian Standard set a standard for that training, and there wasn't any dedicated resource that went with that so that you could say, right, my staff have done this training and it meets the standard, so I can confidently say that all of my staff do meet this standard. So last year we put in place the discussion tool, which is on the first link here, which is a kind of offline tool that you can use flexibly with individuals or with staff teams. It pulls together a number of free resources that are available online that you can use to meet that requirement. What's new this year is that we have now developed a set of e-learning which is available on the Digital Care Hub site on this link, the bottom link here, which if your staff, all of your frontline staff complete that training, that does completely meet the requirement for that question within the DSPT. So it's much easier for you to complete that now, and that's a completely new resource within the last year. So it's set out really clearly with modules. It's got nice kind of infographics, and it is designed for frontline care staff, so it completely meets that standard. So that's the new thing that's come in this year, really. So that's one of the questions that we know that people find most difficult to answer. But I'm just going to check, are there any specific questions that people are highlighting, Marta, that we should focus on at this point?
Not at the moment.
No? Okay. So shall
Yes,
I
that someone asked if the e-learning is free. Yes, it is. It's completely
Yes.
free. I've just popped the link in the chat directly to the website as well. But if anyone's struggling with specific questions or anything specific, now is the time. So someone put in the chat, ROPA and IAR, how do we do these?
Okay, the rope and the
Yeah,
AAR. Okay, we'll move on to that next, I think. So let's have a look, shall we?
on this, someone asked in the Q&A, we use Social Care TV as our provider for cybersecurity. Is this okay?
It's not one that I'm familiar with, but you can check without the learning outcomes that we've put on. So if you go onto the link that we've added for the e-learning resources that we've developed, there's some guidance in there for managers. So if you have a look at that and check it against the learning outcomes, as long as it meets the learning outcomes, it'll be fine. It needs to cover both data protection and cyber security and protection. So those are the key things that you need to check. But all of that information is available there in a manager's guide on that link. So you can have a look at that and you can make a decision of judgment about whether you think that is right, and maybe have a look through our e-learning and see if there's anything it covers that your training that you're using doesn't cover, I would suggest. Okay, right, let's move on then. So actually the next thing that I was going to focus on, I will get to the RAPE and IR, but one of the things that we know that organisations have fed back to us that they find quite tricky is around business continuity plan and whether it covers data and cyber security, as well as all the other things that your business continuity plan would usually cover. So we know that most organisations will have one, and they tend to cover things like, you know, electrical failure, flood, fire, even pandemics. But sometimes they still don't cover the digital and cyber security elements. So there is a question in the DSPT around that, which some people find tricky, and also around testing that business continuity plan. So where to start, really? So I've put a link in here to some Digital Care Hub guidance around how to do this, but it's thinking about what are your critical IT systems and paper files and identifying your critical devices. So in terms of what's critical, I would say, what is it you need to use every day? What is the data and devices that you need to use every day to be able to perform your job, to be able to carry out the care services that you provide to people? So those are the things that you really need to concentrate on. So if without your systems, your software or your devices, you're unable to access things like, for example, care plans or medication records or next of kin contact details or staff contact details. These are the sort of things that you really need to be concentrating on in your business continuity plan. So we have on that link that I put in there, we've got some guidance and we've got some templates that you can use to help you with this task. So you would think through kind of what are those critical devices, systems, software and things that you use. And then it sets out kind of like a template with some questions to help you think it through. So think through scenarios then that might happen. So what are the things that might happen that would prevent you from accessing the data that you've got? So for example, it could be that there's a power cut, your systems could be hacked. What if the devices that you use or a critical device that you've got might be like a laptop were to break or be stolen or lost? Or what if your supplier's systems, your IT supplier systems were faulty? And it's always best to think in terms of prevention rather than cure. So what measures can you put in place to avoid it happening in the first place? But if it did happen, what would you do about it? So this example that we've got here is that, you know, you've got a critical laptop, it contains a lot of the data that you need to do your everyday, perform the everyday business function. It breaks down, you can't access care data, and you've lost your staff records. So it encourages you to think, well, how likely is that to happen? So you can give it a red, amber, or green. So you think, well, you know, you think through your scenario and what fits that, whether it is very likely or very unlikely to happen, or somewhere in between. And how bad could that be? So what would the impact be? So if that device was lost, damaged, hacked, you couldn't access the information that you needed to, what would the likely impact of that be? So again, red, amber, green. And then obviously if you've got something that's showing up red, you really need to think seriously about how you would prevent that from happening and what you would do in the worst case scenario that it did happen. And you work your way through the reds first, and then the red ambers, and then work your way down to the ones that are less likely to happen that maybe you've graded as green. So how would you prepare for it just in case? So in this example, make sure that they've got backups that are working and you can actually restore the information. So you're doing regular backups, but you're regularly checking that the data is useful when you collect it back. You put in place alternative access to care data and staff records. And that could be, for example, you could access this through cloud systems or through a different device. So, you know, in that scenario, if you're a small organization and you use one laptop, that's going to be much more critical than if you're in a really large organization where there's 100 laptops and you could use a different device to access the same data, for example. So, so you do that, you work your way through that using our templates, and you get a plan in place. But what's really important is to make sure that your staff are aware what the plan is and they know what to do if there is a failure. Make sure that you update your policies and procedures to match your plan, so that, you know, if something does go wrong and people are looking for written advice about what it is they ought to be doing, they've got access to that and it's accurate. And then test your draft plan. So this is the second question on that topic within the DSPT. So you could do things like mimicking a power cut or phone internet problems, you know, unplug the router at work, maybe hide a computer or a smartphone, lock the office door, could be simulating, say, if there'd been a fire in the office, or send a pretend phishing email to staff to see if they'll open it. So, you know, you've done your training for staff to say, these are the sort of things you ought to avoid and not click on links and open and things. So kind of testing out your plan. And the DSPT requires that you test your plan at least annually. So just going in and checking that staff actually know what to do if there is a problem. Okay, so mobile phones and mobile devices is another area that it's a high risk area for a lot of organisations, and one that can be quite tricky to navigate. And a lot of care providers have fed back to us that they do find that quite a challenging area to know what to do in. So if it doesn't apply to you in the DSPT, you can just say it's not applicable, but I haven't actually come across a single care organisation where there isn't somebody using their own device to access information about people within the organisation, staff or clients. And that could be through emails or accessing emails on a smartphone or a laptop, or it could be using WhatsApp to talk to each other about continuity of care, that type of thing. There is a lot of use of own devices within the sector, and some of it is unrecognised. And it's better to not turn a blind eye to it. It's better to actually acknowledge that that's happening and make sure that you're managing the risks around it effectively. Because, you know, if it went wrong, you need to be able to control the situation. And it is tricky because if people are using their own device, it's harder for you to control than if they were using a company supplied device where you can put certain stops and checks on it. But saying that, there are things that you can do. So you can check, for example, do your staff have a PIN or like facial recognition or something that locks their phone? Do they update their software on their devices regularly? Do they access public Wi-Fi? And can their device be tracked and wiped if it was lost or stolen? So if they have actually got personal data that pertains to your organisation on that device, can you track it, locate it and wipe it so that nobody else that shouldn't have access to that information can do that? And also, just do the family have access to that device at home as well? Can they lock down certain aspects where they're accessing personal data? So all of those things, they can be done. You might need to look at putting certain terms and conditions in place for staff, adding it into contracts, for example, but it is a requirement of the DSPT that if there are any staff using their own devices at all to share any personal information about people within your organisation on them, like I said, using email or even WhatsApp, those types of kind of chat things, you do need a bring your own device policy. That is a mandatory requirement, even for approaching standards. So like I said, you can enforce the policy through staff contracts. Check what people are doing. So include it in your staff training, in discussions, in staff meetings, that type of thing. So people are aware of what's expected of them, but then check that people are actually doing it. And check what your arrangements are for when staff leave. How do you make sure that you've removed access so they don't have ongoing access to personal data that they now no longer should have access to? So I've put in a couple of useful links here for from the Digital Care Hub. There's a template policy there that you can use, but also the Information Commissioner's Office has got some really good guidance on this area as well. And some more useful resources here for you about from Digital Care Hub around protecting devices and tablets. And the National Centre for Cybersecurity has got some good advice on there around keeping smartphones and tablets safe that you might want to refer to as well when you're thinking about your policy. Again, some further useful things that you can put in place. So I've just put in some links for you there. How to erase a lost Apple device, how to lock and erase an Android device, and also Samsung smartphones. So there is quite a bit that you can do around this area, but it is something that you need to kind of identify and address it really. Right, so this is moving on to looking at the person who asked the question about doing a register of processing activity and an information asset register, so a ROPA and an IAR. So in the DSPT, there are a few questions, but there's one specifically about, does your organisation have an up-to-date list of ways in which it holds and shares different types of personal and sensitive information? Okay. If this is something that you don't have in place at all, on this link here, there's a workbook. It's a really user-friendly, easy to follow workbook, which just takes you through step by step about what it is you need to do and what you need to get in place to make sure that you meet this requirement. So it is a requirement, it's not just the Data Security Protection Toolkit, it actually is Data Protection Act requirement that you have this in place. And the easiest way is to have these two separate lists. So an information asset register, an IAR, and a record of processing activities, a ROPA. So as a social care provider, you are classed as the data controller under the Data Protection Act and under GDPR. This means that you need to document specific information about your processing activities. So again, we've got some useful resources on Digital Care Hub. So there's a template on this link here, which you can use to go through, answer the questions about the different types of data that you hold. Think about it on quite a high level. Don't go into too granular a level. So think about kind of the different categories or groups of data that you hold and process. And there's a list of 15 questions there. So you'd identify the types of groupings or categories of data that you hold. And then for each of those, use the template to work through the 15 questions and answer those. And that will give you your information asset register. It will be done. It's not difficult, but it just takes some time to just sit down and work your way through it. So that's your ROPA. And then everything, basically, this is saying that everything that your ROPA is then a subset of your information asset register. So every type of category of data that you process should appear on your information asset register. Anything that kind of you transmit, so you receive from somewhere or you send it somewhere else rather than just holding it, it then needs to go into a register of processing activity. So there's another template here. I've put the link in for you. Same again. So look at your information asset register. all of those categories of data that you hold, that you transmit in some way. So you've received it from somewhere, you're transmitting it to somewhere. You need to identify those, and then there's a set of 20 questions that you work your way through them. And at the end of doing that process, that will give you your register of processing activity. I mean, obviously, this is a really high level that I'm talking it through to you this afternoon because of the amount of time that we've got. But that workbook on the previous link, that literally takes you through it step by step. It's a really kind of good guide to follow if you don't have anything in place at the moment or you want to check what you've got. Further information and guidance on this. So the Information Commissioner's Office has got, so this is looking at the other two questions in this area. There was one around a privacy notice and one about doing data protection impact assessment. So the ICO's office got a template for a privacy notice. We've also got one on the Digital Care Hub as well. So you can use either of those if you don't have one, or if you want to check what you've got with what we advise. But basically the headings that you need for a privacy notice are that you need to look at what are the types of personal data that you collect, how do you get information and why are you holding it, how do you store it? So, you know, some of it could be on paper records, some of it could be on digital records, some of it could be held on a cloud, for example. Telling people what their data protection rights are around the fact that you're holding some of their personal data and how they can complain to you if they have a disagreement about either the data that you hold on them or how you're holding it, how long you're holding it, for example. And the last point here is about data protection impact assessments. There's a requirement within the DSPT that you have added into your policy how you go about doing these. So this is about if you're making any changes, implementing something new, or doing a project which is going to affect the way that you hold your some or all of the personal data that you handle, you need to do like a risk assessment, really, of whether that could potentially put any of that data at risk. So, for example, if you were going to be introducing a new medication system or a new care planning system, you'd be expected to undertake one of these risk assessments to show that you've thought through those risks and how you were going to control them and minimise them. And also, if you have done a change recently and you didn't do one of these, it's advisable that you retrospectively do one, because there still might be existing risks that you've not addressed. So, but again, I've put in a link there for you so that you can have a look at those. So if you're new to doing the DSPT, when you first register, you will need an ODS code, which is your Organisation Data Service Code. So it'll be a unique code for your organisation, and there'll also be a unique code for each site that you have registered within your organisation. If you need to find out what your ODS codes are, there's a portal link here. So you click on that and it will take you in and you can search against your organisation. You can put in various different things like the organisation name or a postcode and things like that, and it will show you what your codes are. If you can't find a code, or you're not sure, if you're a multi-site organisation, for example, and you're not sure which of the codes that show up for your organisation you should use, and you need advice, or you need any technical advice around using ODS codes, then we've got a help desk at Exeter. There's a telephone number you can call on there, or there's an email address as well, and they're really good. They'll sort out any sort of technical issues or any coding issues that you've got. So it might be, for example, you've done all of your existing sites under one code, and you acquired a new site last year, but now they're all on the same policies and procedures and they all get the same, it's all exactly the same. So you want to add them in to your existing DSPT, anything like that, they can help you with. Right, so publishing or republishing your DSPT. So let's have a little look at what is it you actually need to do now. So if you're at this stage where you're thinking, right, we do need to publish or republish before the 30th of June, we just need to get on with it. What is it you actually need to do? So obviously you need to get yourself logged in. If you're not registered, get yourself registered. Complete all the mandatory questions. So whether it's your first time and you're going to go in and complete the mandatory 26 questions for approaching standards, you can do all 42 if you want to. Or if you're going back in and you're going to see all of the questions. You need to do all the mandatory 42 questions. So you can go in, all of your answers that you have put in previously, if you've done it before, will be there. You can go in, just review them, see what you've said. If you've attached any documents, check they're the most up-to-date versions, and see if anything's changed and basically update it. So it should take you less time if you're reviewing it than when you first did it. And depending on how much change you've had in your organisation will sort of dictate how long it's going to take you, really. So review and update your existing answers, and then you can go ahead and publish. So remember that when you publish, it's only your status that gets shown to everybody. So it's not that everybody can see your answers and your reports, everything that you've put in on DSPT. It's just that organisations can then go in and check your status. So it will just say your organisation name, the date that you published, and to what level you published. So it will say whether it was approaching standards or whether you've achieved standards met or even standards exceeded. And that's all that anybody else can ever see unless you choose to share more with anybody. Okay, so reviewing and updating existing answers. So when you go into the DSPT, hopefully if you've been in before, you remember it looks like this. So it'll have the question number. The blue text in the list of questions is what you click on to get into the question to answer it, and it will give you more detail. And then it will say next to it whether it's mandatory. And if you've gone in and put in, if you've ticked a box or you've answered the question or you've uploaded a document and said save, it will show that that question is completed. Okay. So if you're republishing, only answer the questions that are marked mandatory. So remember, if you're republishing, you're going to go into a screen which has got all 78 questions, only do the 42. If you want to do extra, that's fine, but you only need to do the mandatory 42. Leave the others blank. Click on the evidence item in blue to answer the question and also to see more guidance around what that question means, and review and update your existing answers. So this is an example here. So that's assuming we've clicked on that blue text for question 4.1.1. This is the question here. Does your organisation have an up-to-date record of staff and volunteers, if you have them, and their roles? So this extra text here is kind of what we call a top tip. It gives you kind of advice or explains the question in a bit more detail. So for this one, your organisation must have a list of all staff and volunteers, if you have them, and their current role. This list should be kept up to date, including any change of role, new starters, and removal of leavers. This might be linked to your existing payroll or rostering systems. So this one, which the majority of questions are, is a tick box. So it's saying, do you have a list? So if you have one, you say, yes, you tick it. The comments boxes, all of the questions have comments boxes, which are optional, but they're really useful. They're very useful, and we do encourage you to use them. And the advice we give is that you fill it in as if it's not going to be you completing it next time. Because if you adopt this and all it's got is a tick in the box and no comments, no text with it, it's going to be more difficult either for you to do it next year or for somebody else to pick it up from you and do it next year. So our advice is to use the comments boxes if you can and where it makes sense to, really. So this is an example that we've said we've completed that one. Yes, we've ticked the box, and the type of comments that you might put in, for example, that you can see there that we just put in some text that would make it easier to understand next time somebody goes into it, in which might not be until a year's time. So publishing your updated DSPT status. So once you've answered all of the questions that have got mandatory next to them, so it will say completed where it says mandatory, you'll go scroll right to the bottom of the screen and you'll see this blue button here that says publish assessments. Okay, so you click on that and that sends it off, that publishes your assessment. For those of you that are at headquarters using that code, you would then, at that point, you can go in on here on the screen where it's showing you that blue where it says view branches. You click on that and it will open up and it'll have a list of the branches that you've got, and you can select the ones that you want to publish under this DSPT assessment, or there's a box that says select all. So if you're just doing one for your whole organisation, you just select them all and then you go ahead and publish as before. If this happens when you press that button and you get a list of red questions at the top, don't panic. It just means that some of the questions, the mandatory ones, you've missed. It might be that you've put in the answer, but you've not pressed save in it. So just go back in, make sure you've saved it so that when you come back out, it shows it as completed, and then it'll let you publish. The ones that are in red here, you can literally click on the red link there and it will take you to that question. Once you've published, you'll get this is just an example email from a little while ago. So this is just one. This is the type of email that you'll get that will confirm that you have actually published. So just so that you've got that there for your records and your confidence that you have successfully published. Okay, so I'm going to move on to talk to you about what other support is available for you. So if you are stuck, if there's something in particular that you think, oh gosh, there's this area, I can't get registered, I can't answer this question, I need a bit more help with something, whatever it is, there's lots and lots of help that's available for you. So the Digital Care Hub, which I've put the link in here for you, has got lots and lots of resources that are available for you. So anywhere in the DSPT where it requires you to have a document of some sort, we've got a template for it. So there isn't anything that you need to invent from a blank sheet of paper. They'll have some sort of template in there with some advice around what best practice should say, that the type of things that you need to think about, or the types of things that you should have in there, or clauses that you need to cover. We've also got online guidance, step-by-step films. We've got recordings of webinars like this, which you will be sent a copy of this recording at the end, along with the set of slides with the links in it. We've got frequently asked questions, as I said, template policies. We've got a helpline. So as well as the Exeter helpline that will help you with any technical issues and coding issues, we've got our own helpline, which I'll show you the number and contact for that in a bit. And we've also got local support partners. So there are 28 local support partners right across England. So there'll be an organisation in your area that can give you whatever help and support you need to complete your DSPT. They'll offer things like training and support. They can do online one-to-ones. They could, in some cases, if you need it, they can even come to your organisation if that's the level of support that you need. So don't worry about it on your own. If you're really stuck with something, get in touch with somebody, look at Digital Care Hub. Everything you need to do it is there and available for you, and they're ready to help you. They're keen to help. So I've just added this in from the Digital Care Hub for you. This is all the kind of templates that we've got available. You can click on these and it will take you straight to them on the website. So if you're looking for something specific and you spot it there, you can go straight to it. Some additional further guidance and resources that we've got available around staff, IT suppliers, how to improve your security, that type of thing. Here's a link so you can contact your local support partner. And here's some more guidance around registering for free updates. So if anything changes, then we can keep you up to date with it. So as I said, 28 LSOs, local support partners across the country, one-to-one, small group help. For larger providers, we've got this help desk and this number here. So if you're in like quite a large multi-site organisation and you need some help and support from us, that's who you need to contact there. And again, the Exeter helpline and telephone number if there's any technical or coding issues. Okay. Right, it's quite a whistle-stop tour through quite a lot of information on some of the things that you might have been finding are preventing you from publishing your DSPT. I'm just going to take a little pause now and see if we've got another sort of 15 minutes left. So Marta, are there any specific themes or questions that people are coming up with at the moment?
Someone's asking if there's any penalties for not completing the 30th of June.
No, there are no penalties. So this isn't like a mandatory kind of legislated thing that somebody's going to come down on you if you haven't done it. But what happens if you haven't published is that you lose that continuity. So you're no longer compliant. So come the 30th of June, you are no longer DSPT compliant. So for your like CQC registration, and if you're doing any contracting through the NHS, through a local authority, or from somebody else where you're receiving funding and they require you to be able to demonstrate that what your digital and cybersecurity arrangements are, and you've got good risk management in place, or they may even say that you've got to have the DSPT, you no longer are compliant. So that's what that deadline is, to say you need to have completed by then to get that continuity of compliance. Anything else, Marta?
Yeah. Right. Someone is asking that if they have a policy in-house, whether they can upload that or they need to use our templates.
Yeah, no, you can use your own policies. So absolutely, ours are there to help people. So if you didn't have one, or you wanted to check what yours says against what our best practice kind of model, if you like, says, then that's what that's there for. But if you've already got your own policies, you don't need to redo them. Just check that they're doing everything that they need to do, and then you can upload those. That's fine.
Another question on how long on average does it take to complete to standards met?
Sorry, say again, how long does it take to?
To complete to standards met on average.
Okay, so if you're brand new to it and your organization is brand new to it, it really depends what you've already got in place. So if you're already feel quite confident that you meet the Data Protection Act and GDPR requirements, and you've got things like a data use policy, and you've got your privacy notice, and you've got up-to-date lists of your staff, and all of your arrangements, you know, you are actually actively managing all of those risks, and you're doing all the things that you ought to be doing through legislation, then I mean, we get feedback from people that if you've got everything in place, you could sit down and do it in an afternoon. But it is a bit of like, how long is a piece of string? It depends how much work you need to do to get yourself to the point where you are actually compliant, and you can say yes and tick those boxes in it to say, yes, we are compliant with this. So say, for example, if you're not confident, that you could say that all of yours, 95% of your staff have been trained to the right standard, then it's going to take you a bit more time to make sure you get those arrangements in place. But that's why some of the questions are not mandatory if it's your first time at it. So that is one of those questions that you can take a little bit more time to get things in place if you don't already have it there. So sorry, I know that's not a definitive answer, but it is very different for everybody, and it depends how much time and how many interruptions you get when you're trying to complete it, really. But if you are really up together and you've got everything in place, you can literally sit down and do it in an afternoon. Anything
Thank you,
else,
Sally.
Marta? Okay.
Someone's asking if can someone check our answers before they publish the DSPT? I would add it to this that you can contact your local support organization and they will help you through that if you have questions on like whether something's right or not that you have inputted. So we don't offer kind of like reviews per se at the moment, or like you're gonna call them checks. It's something that we're looking to explore to help providers make sure that the quality of the DSPT is right. But for now, if you contact your local support organization on your local area, which is again is free support, they will be able to help you if you have specific questions on anything you've answered, whether it's right or wrong. So I'll put the link in the chat, and I will link it again once more.
Yeah, I don't think I can add much to that really, but yeah, so as Marta said, we don't offer a full check at the moment. It's something that we're looking at, but yeah, if you've got particular issues that you're worried about, or you know, you think, oh, I'm not sure, I just would like somebody to look at this, or yeah, contact your local support organisation, and they've got people there that can help you on sort of targeted specific advice, or they can point you in the direction of resources that you can then, you know, check it yourself.
Someone's asking if there are extensions to the DSPT if they can't complete by the deadline.
No, there isn't a kind of process where you can apply for an extension and continue your compliance past the 30th of June. But you know, I would just say get on and do it as quickly as you can. So if it does lapse after the 30th of June, We then have a period where we take the system down and we update it and do anything we need to for the following year. But yeah, just get on and do it as soon as you can, really.
Yeah, that we never know when the
No,
DSPT technical team are going to roll
no.
over the next years. So I would say just aim for the 30th of June. Um, yeah.
Yeah.
More questions coming in.
Okay,
So um so once they have uploaded all the policies and answered the questions, how long does it take to provide an assessment that they've met all the standards?
Okay, so once you've completed all the questions to the standard that you're happy with, your organisation is happy with, and you press submit, you publish, that's it, you are published. So as Marta said, at the moment, we don't offer a service that reviews your assessment, and it's confidential to your organisation. So it's only people that you give access to within your organisation that can go in and see that then. Um, so there isn't any, at the moment, there isn't any way for us to kind of assess your compliance. It's really is about you assessing your risk as an organisation and putting measures in place to manage that risk effectively and giving yourselves the confidence that you're meeting that. And by completing all of the questions and putting all of the things in place that's suggested within the DSPT, then you can meet the kind of Data Protection Act and GDPR requirements. So yeah, and then in future years, you can always go back in and improve things. You can put more, it's all about risk management and you kind of, being able to put in place what is right for your organisation.
Great. Someone else asking uh that they were informed they had a year to complete it from the time they were funded. So is this not the case? I'm assuming this is for your DSCR funding. Is that right, Jennifer? Yeah, that's correct. So from the funding, basically, this is something the DSPT is not just that you have a year; it's like you have to complete it every year. So from the time you are a CQC registered provider, this is something you just need to review every year. And obviously, if this is something that they've advised in terms of the funding, yes, but the problem is if you don't publish by the 30th of June, you will not be compliant for that period of time. So I would aim for 30th of June.
Yeah. Yeah, once you've done it once, it's a case of keeping it up to date and reviewing what you've already put in and then just updating anything that needs to be updated. So it is more work the first time you do it, but when you go in and review it, hopefully then it'll kind of take you less time to do that. Anything else, Marta?
Yes, someone's asking that if they submit and not everything's correct, whether they have the option to review. And I would say yes, again, there's nothing that's gonna say that your answers are wrong. You'll something will come up if you've not answered something or if you've missed ticking something or a document, but there's nothing that will say your answers are wrong because this is a self-assessment. But if you think that you've inputted something wrong or you contact your local support organization and you want to go through a specific question and there's something to edit, you can always log in and update it and save it and republish it again any time of the year. So there's no any in any case you that you complete it and then you can't go into it again. You can just log in anytime and update it. And we actually recommend that you do that throughout the year. So you keep everything up to date. So when it comes to actually republishing and properly republishing with your all your answers for the year, then everything's updated.
Yeah, that's the ideal, isn't it? So there's no limit on the number of times that you can go in and save, add to it, save new things. Yeah. So it's not that you can only do it once a year, that's the absolute minimum.
Someone's asking, what impact does the DSPT non-compliance have on CQC assessments?
That's a really good question. It's an area that we're working on with CQC to get some more clarity. So it is part of their single assessment framework now. So we don't know exactly what they're going to look for when they come in to do an inspection, but it is in there in writing as part of their single assessment framework, and it's just, I guess, is a very neat way for you to demonstrate to them that you are managing this area effectively, that you've got measures in place to meet your data protection GDPR requirements, and that you're managing the risks around your data and cybersecurity and protection. So it is something that in the future they will be looking for.
Yeah, I would also add Mark Sutton, the CQC Chief Digital and Data Officer, said that the CQC will increasingly expect a good provider to comply with the DSPT or equivalent as a minimum. So this obviously applies to any digital paper. So what we expect is that it will be more difficult to get good rating without something like this, because it basically shows that you have good management of your data. And it has been included into the well-led assessment under the single assessment framework. So that's the link. But there is something quite new still that they've included this year. So they're still working on it. But there has been some cases where they've been looking at whether to check whether you have your DSPT in place or not. I'm just adding the link from our website that we've written about CQC.
Good. Yeah. Lovely. Anything else, Marta?
Nothing so far, unless anyone else has any more questions. Please put them in the Q&A if you can. A few people have asked, but yes, the slides and the recording will be sent to you either after this webinar now or tomorrow latest. And this comes via email through an Eventbrite email. So the same emails you've got from Eventbrite alerting you of the webinar, there'll be a post webinar email, and you will receive the all the links to the recording and the slides and any other resources.
Okay, so what you'll see when you get the slides is that there are some other additional slides that I've not got to today. So depending on how many questions there were, we had some other sort of useful things to go through with you, but that you can look at those. They are on the slides for you, just so that you don't think, well, why have I got all these extra things that we didn't talk through on there? So there's some things in there that you might find useful. So is the last thing for us to do then, Marta, to launch the ends of the webinar poll?
Yes, I'll just launch it now.
So again, really useful if you could please just fill in the poll for us, because it helps us when we're designing our resources and help and support, if we can understand a bit better about you know, whether is that a positive impact, where you heard about it from, how likely you are to contact your support organisation, that type of thing. So if you could do that now, we'd be really grateful. Thank you. Just wait a little bit longer, just to give you more time to go through those questions and do them if you could. Right. So thank you ever so much for filled in the poll there for us. Looks like some quite positive feedback there. Looks like most people are saying that they're very likely that they will go ahead and publish, and that they will contact their local support organisation, and that the majority are saying that has increased your confidence. So that's great. That's really positive. And as Marta said, you'll get the recording and the slides as well, which I've tried to put lots of useful links in there for you just to make it easy. So hope that's useful for you. Okay, well, thank you ever so much, everybody, for joining us this afternoon. And yeah, if you need more help, do contact your local support organisation. Thank you ever so much.
Thank you.